This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Hello, I'm so grateful that you chose to listen to this podcast. I'm Dr. Judith, a board-certified psychiatrist and researcher. And on this podcast, you will hear from world-renowned experts. At the end of every single podcast of The Vault, every expert talks about a time in their lives when they were struggling and no one knew it. And they talk about what they used to get through that struggle. So make sure you listen through till the end and you subscribe and share with a friend. Do you avoid looking, down there? I will never forget the Sex and the City episode where Charlotte called her womanly parts ugly, but many women feel this way. Dr. Milhouse is here to change that. She is one of the less than 1% of women urologists in the country, a Black woman surgeon that specializes in the womanly and manly parts that no one likes to talk about. She's also an expert on the role of hormones. I had no idea that estrogen was important for men too. We break down sexual myths and talk about how you can reclaim joy through intimacy and self-love. Why is learning about the different hormones really important in terms of sexual health?
Female anatomy and physiology is different from male anatomy and physiology. There are more similarities than we realize. And one huge misconception is this male hormone, female hormone, okay? Testosterone is a male hormone. Estradiol or estrogen is a female hormone. And in fact, both of us, men and women, have both and make both and need both, okay? And in fact, women produce more testosterone than they produce estrogen. Similarly, I tell my male patients when I'm monitoring their hormones, they're on testosterone, and I check the estradiol level, and they're like surprised, number one, that I'm checking that. And then they're like, what is this estradiol? Let's get rid of it. I'm like, no, you need some of that. If it's too low, that could interfere with your sexual function and your desire.
Also, like what you said, know the signs. What are the signs that you have? First of all, what are the signs that you have low testosterone as a man versus low testosterone as a woman? I became a fan of Dr. Milhouse over social media. Her page is so hilarious and informative, and she's just absolutely radiant inside and out. You're about to get that knowledge from this episode of The Vault that you are too nervous to ask your doctor about. And we're going to take the conversation there.
It's first of all not supposed to smell like roses and taste like candy. It's a body, it smells like a body.
Dr. Milhouse, thank you for being in The Vault.
Thank you for having me. I am excited.
I am too. I've been following you for so long, and I have so many questions for you. So I'm just going to jump right in. I love your content that is focused around like taboos and, things that like you wish you knew when you were younger and how to advocate for your health. And I see myself in that content because some of the stories that you have, I'm like, wow, I wish somebody like you was practicing when I was younger. Tell us about some of the things that you see or that you've seen over the years that you just wish everyone knew about their sexual health.
Yes. So first of all, I wish that we all knew our body parts. I wish we knew the anatomy, especially vulva owners, women. We do not know our body parts. We think we do. And there's a lot of lack of knowledge that allows for sexual dysfunction and genital issues to be ignored or to be dismissed or, not to be understood. So one, I wish that we looked at our body parts, that we weren't ashamed of them, that we talked about them, that we said vulva and we didn't just call everything vagina, that we said, clitoris, and that, we told everybody this is the urethra where you pee out of. The way, men can see their genitalia very easily and they look often the way I wish that women would look often. Number one. Number two, I wish that we understood that historically, sexual intercourse is very penocentric. It's very male member centric. It ends with, it's revolves around penis and vagina penetration, and it ends with male orgasm. And there is like little to no expectation for a woman to orgasm. There's an assumption that she orgasms, at some point before he orgasms, and that happens in penis and vagina sex. And in fact, we know that majority of vulva owners require clitoral stimulation to orgasm. And so alone, penis and vagina sex is unlikely to get majority of women to orgasm as they should. And so we have this orgasm gap. We talk about, the gender gap, wage gap. There's an orgasm gap. The gap is wide between heterosexual women and heterosexual men. That gap is really very narrow when you talk about women who have intercourse with women. And so lesbian women have a much higher chance of getting an orgasm. And that's because it's not penocentric. It's not penetration centric. There's an expectation of orgasm. Like you don't have, there's this expectation, of course we're going to orgasm. So those are the two main things.
Yeah, I think that's important. Like we don't even know what we're working with and we don't even know how the things we're working with work. So there's that lack of satisfaction. But then because we don't know, then we blame ourselves and we take it on ourselves as like, okay, maybe it's something wrong with me. Maybe someone else is having a better experience. But I think when we normalize it, it's super important. And there's a challenge because like, even as you were talking about it, I'm thinking, okay, how am I going to say these words differently on my teaser for my promo for this? Because like the algorithm will block this information because of like, using terms that are legit, that are medical terminology. So that's another blockade in terms of our access to information because we can't even use the terms that we need to use, right? Right. So I think, having these conversations on podcasts where no one is regulating what you're saying, where you can use medical terminology without disguising it is so powerful because many of us will go to our doctor, we'll have 15 minutes and we don't get to ask these questions, but being able to listen to this information at home in the privacy of our rooms is so powerful. Tell me more about the differences between men and women, because I think a common misconception is that women don't have testosterone and that, we shouldn't even be thinking about that as a hormone, but how that is actually false. And why is learning about the different hormones really important in terms of sexual health?
Yeah, I think honestly, although, female, anatomy and physiology is different from male anatomy and physiology. There are more similarities than we realize. And one huge misconception is this male hormone, female hormone. Okay. Testosterone is a male hormone. Estradiol or estrogen is a female hormone. And in fact, both of us, men and women, have both and make both and need both. Okay. And in fact, women produce more testosterone than they produce estrogen. Like that fact usually blows people's minds that there is actually more testosterone in our bodies than there is estrogen in our bodies. Okay. Do we make as much testosterone as men are supposed to make? No, but we have a whole lot of testosterone and we need it. There's testosterone receptors everywhere in our body, brain, our heart, our vulva, our vagina, so many areas. And so I tell patients that your body needs it. As we get older, our levels of testosterone decline and we may have manifestations of that. Similarly, I tell my male patients when I'm monitoring their hormones, they're on testosterone, and they're asking me about, and I check the estradiol level and they're like surprised, number one, that I'm checking that. And then they're like, what is this estradiol? let's get rid of it. I'm like, no, you need some of that. Like if it's too low, that could interfere with your sexual function and your desire too. So I think we are recognizing, like you're saying, the public is learning this in their homes because of the access to good information, and that access is meaning that they understand, oh wow, hormones are not as simple as one is for a man, one is for a woman.
Yeah. And also like what you said, know the signs. What are the signs that you have? First of all, what are the signs that you have low testosterone as a man versus low testosterone as a woman?
Okay. So the signs that you have low testosterone as a man typically mimic like a low grade depression, low libido, low interest in even other things that used to interest you, feeling fatigued, low energy. There, may be loss of like muscle strength. There may be a decreased ability for performance. Those are the main symptoms that we see in men. And then in women, it's pretty similar too. Decreased libido and decreased energy are like the biggest symptoms that I hear attributed to low testosterone. Also, brain confusion, brain fog is a pretty common one. And just feeling mood dysphoria, just not like mood. Testosterone is really important for mood. And so just feeling just this dysphoria or very labile mood is a common complaint as well. So these things make me think, okay, let me think, is testosterone appropriate for this individual? Let's check it and go from there.
I did know that women have testosterone. I didn't know that you're supposed to check estradiol in men. So I learned something new today.
Yep. So yeah, we check it because when we replace testosterone, the estradiol can get too high. Okay. And so because testosterone can be converted to estradiol in adipose tissues, in our fat cells and that sort of stuff. And so we check it to see if estradiol, we check the balance. We're looking, for like a 1-to-10 ratio, ideally, testosterone 10 times estradiol in men. And if it gets too high, again, we don't want it too low either, but if it gets too high, then that can cause like actual like breast tenderness and those type of symptoms.
Well, since we're on the topic of hormones, one of the things that I was really eager to speak with you about was perimenopause and menopause, because, there's this huge awakening happening where people are learning about perimenopause, particularly in Black women, because we go through perimenopause sooner. We go through menopause longer with more severe symptoms. But there's this notion that Black don't crack. So like we're getting mixed messaging. We're getting messaging that like, we age like fine wine, which we do, but also we go through these. Yes. Yeah, two things can be true. Like, but on the inside, we're actually having a harder time, right? The surface may be put together because we got that melanin, but on the inside, we actually have a more difficult time with our mood, with sleep, with, our heart issues, bone issues. All these things are impacted by hormonal fluctuations, and it's not something we should just ignore because it can impact so many things in our lives. So tell us about that.
I really wish that we educated ourselves on this thing called menopause, and that it's not just hot flashes, okay? It is a lot more, and that it starts typically in the early 40s, this perimenopause, and it can last beyond, 50. When it comes to, compared to white women, Black and Hispanic women suffer through, particularly the vasomotor symptoms, suffer through menopause symptoms longer, typically closer to a decade. Wow. Where white women may be like 6-7 years. Okay. So we start menopausal symptoms earlier, last longer. We know that unfortunately we are less likely to be offered hormonal replacement therapy. We're less likely to be treated with hormonal replacement therapy. Okay. Even in this movement, this awakening that you're talking about, it is slow to get to us. Okay. We know that the access, the representation, all of those things. Black women are still largely in the dark about their options and the safety and that sort of stuff. One big thing that I shout about and campaign about and try to make awareness about is this thing called genitourinary syndrome of menopause. The changes and symptoms that affect our vulva and our vagina, because it is the most common thing that all of us go through. Even when a lot of us may not experience bothersome hot flashes, like this is the most common thing that almost all of us go through, but it is the thing that most of us don't know about. We don't talk about, we suffer with silently. I have seen this from the moment I got out in practice. I was seeing a plethora of menopausal, postmenopausal women with like severe vaginal pain, burning, dryness, painful sex, recurrent UTIs, itchy vaginas, raw. It feels like a blowtorch. It feels like I'm sitting on shards of glass. It burns so much. I can't I can't even attempt penetration. And I'm like, whoa, what is this? And then no one taught me really well. And then I discovered this huge thing that happens to our vulva and vagina. And one thing that we really should be teaching one another and talking about is vaginal hormones. Vaginal estrogen is safe, it is effective, and in my opinion, in my perfect world, it should be preventative medicine, truth be told, because so many of us are likely to suffer from those symptoms. It is extraordinarily safe, even if you have breast cancer, even while you're getting treated for breast cancer, it is safe. Okay, we are debunking these things. And it's safe for patients who've had blood clots. Even there's literally no vagina, no vulva that you cannot give vaginal estrogen to. And there's most vulvas that age are going to benefit from vaginal estrogen. So that is like my passion project. If there's like one single mantra that I swear I say on my tombstone, it's going to say she ranted about vaginal estrogen to save women. That is so true. So yes.
Yeah. And it's not just for sex. It's for like comfort. It's for like not having to use the bathroom and have pain. It's for a whole host of things. It's not just for the purpose of satisfying a partner or just for sexual pleasure. It is literally an improvement of quality of life. And, and it's really astounding that, we don't learn about this until after we're out in training and talking with patients. And, it's really beneficial for patients to learn about it directly. On the topic of sex, you do talk a lot about common myths, right? And, one of the things I saw you post recently was about like, I think you had a patient or someone went to a doctor and they were like making fun of them because they were like, oh, that was like a wet vagina. And you were just like, actually, that's okay. Like, what are some of the myths that people have?
I called the doctor a hater. I was like, the doctor's a hater. Like, what is that? Yeah.
What are some of the myths that you're like, oh, I can't believe people still think this when they come to you and they say things. What are some of those myths that you hear that you're like, let me debunk that right now?
Yeah. Well, one thing that I hear all the time is like, well, I can only orgasm with my clitoris. And people say it like that, like, oh, I can only do it. I'm like, 86%, this is why. I mean, this is normal. Men don't go around saying, I can only orgasm with my penis stimulated. That's what we're saying. That is literally what we're saying that we sound like. No, our clitoris is like their penis, of course. Like, who's going to orgasm? What man is going to orgasm by rubbing his scrotum? Essentially that's what we're asking women to do with vaginal penetration alone. No, we need clitoris. So that's like one thing. Like, no, this is norm. This is the way it's been designed. Okay. Another thing is, feeling that your vulva is supposed to look a certain way or be shaped a certain way. And we know that their vulva diversity is vulva diversity. Labia minora might be, I'd call labia minora, they're sisters, they're not twins. They may not match up, and that's okay, and that's normal. Now, certainly there are some individuals who may seek to, get procedures done for whatever reason, if it's for a comfort, to trim labia or other reasons. And I'm certainly not shaming that. And I do those procedures, but I want to be very clear that vulvas look very different and labias in particular can be very different. I think this is not so much a myth, but people just use the term or they don't know, but people say, I'm peeing from my vagina. I'm like, you're not peeing from your vagina. You realize that there's a urethra there. You're peeing from your urethra. It's not all vagina. Okay. Vagina is a hole. The vulva encompasses the vagina hole and the urethra hole, but you are not peeing from your vagina. Those, I'm sure if I stop and think there's more, but those are the ones that come to mind.
Well, I often see these viral, and these go viral, and I'm like, is that real?
Yeah.
But I often see these viral things about like, oh, well, if you eat this, you'll taste like good. And like, it's just like, what is happening? Like, is this science? And these are people who claim to be doctors. So I'm like, first of all, why is there so much pressure on women to have everything put together down there? Like, no one's putting that pressure on a man to be completely symmetrical down there. All these like technologies are coming out.
Smell a certain way.
Yeah, all of those things. And I've had patients over the years who've been like having so much shame about, their vaginas. Like they will say to me like, oh, I want to get certain procedures done or they want to have certain things done. And I'm like, what you see on these movies, that's not representative of real life, but there is a lot of shame about body parts and about perfectionism and so forth. So like, what are those myths, in terms of what you're eating and how that impacts your health down there?
As far as we know, maybe certain foods may have an odor, make a more odor to your urine. Asparagus is like a common thing. But like, as far as your vulva and vagina, like it's first of all, not supposed to like smell like roses and taste like, candy. It's a body, it smells like a body. It smells,
and it's very close to your anus that produces feces, right? So like, is a garden supposed to smell like roses if it's next to manure, like?
Oh my golly. Okay. Not manure, child. But no, there are certainly some conditions where vaginal odor is very abnormal and should, is a sign of that. But in general, we over pathologize like scents that are body scents. And we're like, oh, this can't be normal. And, we have been conditioned to think our vagina and vulva is, meant to be flowers, and roses. I just thought of another myth actually. So another myth, and this is like the classic debate that I hear all the time is like, is squirting urine? What is it? Is it urine? Mm-hmm. Is it not? Is it peeing? Am I peeing on myself, Dr. Mills? I will get patients who are like, I'm here because I pee during sex. I'm incontinent. And I have to really fish that. I'm like, okay, are you incontinent? Because you can be incontinent with sex. Like you can have stress incontinence where like the activity of stress, sex is like making you lose urine. But half of the time it's like, no, when I dig deeper, people are like, I'm peeing, I feel like when I climax, and that's not normal. And I have to explain to them that, there is a production of fluid, a type of orgasm that we have studied. They did like ultrasounds of the bladder before they emptied the bladder of women. Then did an ultrasound of their bladder. This is kind of weird. Right before they were going to orgasm. So they knew that they had an empty bladder from urine standpoint. Then they did another ultrasound right before orgasm, and they saw new fluid build up. Accumulation of fluid that build up that is likely different than urine coming from our kidneys. Okay. And in that way, that was what was expelled from the urethra. So we believe that squirting isn't the same identical as urine. It's probably diluted urea coming through the urethra and some expression of the periurethral Skene's glands and female prostate. We do have a female prostate. And so I love talking about that and, trying to debunk that and tell women who are scared to orgasm and squirt, like, let it go. You're not peeing. It's okay.
Wow, that is so interesting. And there aren't that many women urologists, right?
Yes.
Like, you're very, very, very small percentage of medicine. So it's really hard to find people like you. And so making this knowledge accessible is just so important, because many people, they'll need your help, but they won't be able to find someone with your training. So thank you for that.
Yeah.
I always ask my experts to tell me about a time in their lives when on the outside things look put together. Everyone was like, wow, you're doing it. I want to be just like you. You have it all figured out. But on the inside, you were actually struggling and no one knew. And how did you get through that?
I mean, there's many times. I feel like we're perpetually, low key, I'm perpetually like, I'm perpetually on the inside, like, I don't know what I'm doing. I do know what I'm doing, but I don't know what I'm doing, but I do know what I'm doing. Like, perpetually that's going on. And then on the outside, it's like, conveying this, a boss, put together, physician entrepreneur. But I will say, of all the times where it was the most on the brink, was actually very recent. I started my own practice 2 years ago, a little over 2 years ago. And that was a major move, working to build something on my own. And the first 6 months were awful, exciting in the beginning. And then just constant, I felt this physical weight on me, like physical nauseousness perpetually, and just physical weight and physical almost dread that I had to totally mask and hide. I even masked it for, not just, for, social media and for my staff and for my and for acquaintances, but masking it from my family, because I didn't want them to know that I was scared that I made this horrible decision that was going to affect our finances and our future. You know what I'm saying? Hide it from my husband, from my, certainly from my children. And I felt this immense pressure to be successful, this immense pressure from, my family. And it's not like they were giving me the pressure. It was just the innate, pressure we put on ourselves, immense pressure from, people watching, colleagues and friends and, others, maybe some waiting for me to fail and this and that, and pressure I no doubtably put on myself. I was keeping it in and literally one thing away from cracking at any moment, every day. And, there were two things that changed course that helped me to be more balanced. The first was I finally cracked. One day I had double booked myself because I didn't know how to say no. And I agreed to be a speaker at an academic conference. And I don't mind speaking like this, but I dread speaking, public speaking, academic. I actually get the most impostering then when I'm asked to do that. But I say yes to almost all of these invites. So I'm supposed to speak then, but I booked myself for video visits on the same day because I'm growing my practice. And so I'm in my car at the meeting hotel convention space. I'm in my car because I have a few minutes in the garage, trying to do these video visits on quickly before I have to present. And of course, like there's technological problems. My computer's not doing what it's supposed to and connecting and this and that. And I can't get in contact with the patient. And I'm just like break down and cry. And I'm just, you know, like I can't do this all. It's too overwhelming. There's always like something. I double booked myself because I was just spread too thin. And I had to get myself together because I had to present. I still had this obligation. And so I grabbed my Visine in my car. I think that's a sign of a functional, like you said, like functional, depressed person. Like, oh yeah, I carry Visine because, you know, I got to get that red out when I'm crying in my car, right? Okay. You know what I'm saying? You wouldn't know just 2 minutes ago, I was like totally broke down because I got the red. So I got my Visine, got the red out, fixed my face, like, you know, very, you know, like, okay, get it together, girl, fix your face, boop, boop, we're going to do this. Gave my presentation. And at the end of my presentation, one of the participants who I didn't know stood up and said, you know, Dr. Milhouse, I just have to say, like, you are such an inspiration. I am here because of you. I've been following you since I was a med student. And now I became interested in urology. And now I'm interested in female urology and this and that. You know, and she doesn't know, this person doesn't know just how much she like just comforted me. You know, that she just reminded me that, you know, it's okay. You're making mistakes, but you're doing good work. You don't, and you can take a break. You know, that was so impactful. And then shortly after that, I just recognized, I stopped and said, you know what? I don't pray anymore. I stopped praying. I stopped meditating. I stopped taking the time out of the day to just be with myself. Like I literally would get up and go to sleep, go. And I'm like, I'm not doing the fundamentals. And I just said, every day I'm going to start the day in the morning with prayer and meditation. And that was immensely impactful to just take every day, take it day by day and stop, you know, this feeling like I had to accomplish all these things. And that I had to say yes to everything, or I had to do everything, or everything had to be built in this certain time frame. I'm still struggling with that. It's a constant, I think we're like, you know, how addicts are always addicts. You know, we're always high functioning, overachieving, depressed people. But we take it day by day.
I love that. And I love how having that person who was admiring you when you had just had a moment of breakdown remind you that, listen, we all start somewhere and we're not perfect. And we may see ourselves one way, but someone else is looking at us and they're like, wow, I wish I had that, you know? Thank you for your vulnerability. And, you know, people don't realize that, you know, surgical fields are very demanding. They are extremely demanding. They take up your entire like young adulthood. And then you're just like thrust into responsibility. So, you know, when you have a woman surgeon, when you have a Black woman surgeon, just realize what they went through to be there because it was hard. So, you know, honor them. Thank you for being in the vault today. Where can we find you? Where can we follow you and support your work?
Well, thank you so much, Dr. Judith. I really appreciate it. It's my pleasure to come to the vault. I'd love to come back and talk more. People can find me on Instagram at Dr. Milhouse. It's Milhouse with 1 L. People can also find me on YouTube. I have a lot of YouTube content. And that's at Down There Urology. That's the name of my practice. So I named it my YouTube channel. Super easy to remember, at Down There Urology. Or if you just search Dr. Milhouse, my name, you'll get me. I am affectionately called Your Favorite Urologist. And if you want to see me as a patient or you think you need my services, downthereurology.com, virtual visits available and in person.
Thank you. Can people see you even if they don't live in your state or your city?
Yeah, they can, depending on where they are, for sure.
That's awesome. Well, I will be referring some patients to you.
Please. I would love it. Thank you.
Thank you. Thank you for listening to this podcast. make sure that you subscribe. When you subscribe, it helps me to continue to deliver this mental health information for free to millions of listeners. So please support my mission. Please pick up my book, High Functioning, and let's build a happier life together.